Welcome back to ABC News Live. First, the FDA has instituted a new mandate that all women will now have to be told if they have dense breasts when they go for mammograms. Dense breast tissue can make spotting cancer on a mammogram more difficult. Dean of Columbia University School of Nursing and breast cancer survivor Lorraine Frazier is joining me now for more on this. Dean Frazier, thank you for coming on. Walk me through this. Why do you think this new mandate is so critical?
So many times when people leave mammography, they feel reassured that if it's a negative result, that they do not have breast cancer. Unfortunately, for people with dense breasts, it's very difficult for mammography to pick up cancer. Density in breast shows up on radiography with just a white area, and cancer shows up as white. So really trying to find cancer in dense breasts is like finding a polar bear in a snowstorm. And so you leave, and that's exactly what happened to me. Mammography did not pick up my cancer. And it's important because we know if you pick up cancer earlier, it's easier to treat. And so we want people to know that they have, whether or not they have dense breasts, and it's something you can't detect yourself. You can't feel the density, and so many people think that they can. So starting from yesterday, when you have mammography screening, they will let you know whether your breasts are dense or not. They will also let your health provider know. Now, that's just the beginning. They have to notify you within 30 days. So you leave mammography and you have negative screening and you get something in the mail or email that says you have dense breasts. That's really when this is going to make a difference for you. So if you're a patient and you get this letter, open it. The last thing you want to do is go back for more testing. I get it. Take it seriously. You're busy, but make sure that you go and have this screening because it can save your life. And if there is cancer there, you want to catch it earlier. The earlier, the better. I was fine. I went through a lot of treatment. Mastectomy, chemotherapy, and radiation, and I have a great prognosis. But you want to catch this as early as you can. And so my goal today in this interview is to really challenge you to take that step further. Don't wait till next year, because next year some cancers go very quickly, and next year could make a big difference to the treatment that you get. And really, it impacts your whole family. So many women think, well, I put my kids first, my husband first, I'm busy doing this and that. The way to put your family first is to stay healthy, because this will impact your whole family if indeed you let it go.
Dean Frazier, I am one of those people with dense breasts as well. And it can be scary because, as you said, the polar bear in the snowstorm. My mammograms often come back inconclusive. Then you have to wait to get an ultrasound. In my case, at one point, they just wanted to look at one breast, not the other, which didn't really make sense to me. So, and sometimes even the ultrasound itself isn't clear. So what's your advice for patients who fall into this category? Because it's easy to say, take the next steps, ask for the exam, but sometimes you get a lot of pushback in that process.
Talk to your provider. It's a conversation that you have together. Looking at the risks, I didn't have any risk in my family. I had no risk as far as I was concerned, but talk to your health care provider, go over that risk, and then talk about other things that you can do. It could be an ultrasound, could be an MRI, could be a 3D mammogram. So really, the first step is to have that discussion.
All right, Dean of Columbia University School of Nursing, breast cancer patient, Lorraine Frazier. Dean Frazier, thank you for coming on. I know you're due for your final treatment in January. I'm glad you're feeling okay, and we're all with you. So thank you for joining us and inspiring so many of us, really.
Yeah, you're welcome. Good to see you.
Good to see you too. And thank you for watching. I'm Diane Macedo. The news never stops, and neither do we. And we have a lot more news for you right after the break. Stay with us.